I know that, you're still working on it, but I wanted to just tell you at the back of what you've just said now, how much do we know when it comes to the similarities between the variant that was identified in the United Kingdom and what we are seeing here in South Africa, particularly in Nelson Mandela Bay?
So what we know is that one of the genetic changes in the virus, and this one that we're kind of naming this lineage by at the moment, this 501. So that the 501 just refers to one point in the chain of the protein, and that is the same mutation that was picked up in the virus in the UK. But other than that, all the other genetic changes and changes in the protein are different and at different sites in the protein. So it helps us to know that these viruses are emerging with these similar changes, similar mutations, because it kind of tells us about what might be happening in different parts of the world.
And for someone who missed, the briefing and is just watching this conversation tonight, are you able to then, paint a picture for them if we're going to be seeing new symptoms here that we haven't seen before with this variant? And also, are we then looking at an isolation time or a recovery time that could be adjusted?
No indication for that at all, and no indication that this will cause a different clinical illness, and that's highly, highly unlikely. The fundamentals remain the same with this virus. That it is transmitted in the same way, it causes the same clinical illness, and if we are to control it, then we need to respect this virus, and we need to respect the measures that we're trying to put in place to prevent the spread of the virus. And those fundamentals will not change with these small genetic changes in the virus. We need to understand the effect, but the fundamentals of this virus and how it spreads will remain exactly the same.
And I'm interested tonight at what scientists think could be some of the theories that are behind how it ended up here in South Africa.
Well, it's not so much how it ended up here. I mean, it's very likely that this emerged in South Africa and didn't come from outside South Africa. And you'll have heard on the briefing a lot of comments about why we're raising the alarm. This is just natural that all viruses evolve and they develop these mutations. And that's absolutely true. And what we know is that the viruses are under more pressure to evolve the more people are infected in the population. And so one thing that we recognize is because the first wave was quite severe in this country, and particularly in the Eastern Cape and Nelson Mandela Bay, there may have been more pressure on the virus to evolve and for these new lineages to kind of be selected in the population. And that's one of the theories that we'll be investigating in more depth.
And young people are also a concern because it does look like the fact that they may not have comorbidities may not exempt them from some of the severe symptoms.
Yes, I mean, young people have always been a concern. From the start of this epidemic, there's been a little bit of a misconception that young people are not at any risk. What's always been clear is that that older people are at the highest risk of death and serious illness. But it was always the case that young people, a small number of them will get severe illness and a very small number of them will die. So that hasn't changed. And as far as we know at the moment, that is not changed with this new virus lineage. But it is something that we're trying to just look closely at the data to see if there is any sign of that.
And Dr. Lessells, as we wrap up our discussion tonight, viewers are, of course, on holiday mode. Some of them have already started. The festive season has kicked in for some of them. What advice are you giving them tonight, particularly at the back of this announcement?
I think what I said just a minute or two ago, respect this virus. and respect the restrictions that are put in place and the guidance that's being given about how we can all do our part to prevent the spread of this virus. We are still learning about this virus every day. And what this discovery is highlighting to us, that we're still in the very early stages of our relationship as humans with this virus. And we will learn more and more about it, but we have to respect this virus and the suffering that it can cause. And unfortunately, this virus does not respect the fact that it's Christmas and that we all desperately need a holiday. And if we give it opportunity to spread, it will continue to spread, whether or not it has mutations or not.
Dr. Lessells, thank you so much. I do appreciate your time. That was Dr. Richard Lessells from Krisp, the research body responsible for South Africa's new genomics platform to study and counter the COVID-19 pandemic.